M2102, Type and Source of Assistance. Type and source of assistance determines the ability and willingness of non-agency caregivers, such as family members, friends, or privately paid caregivers, to provide assistance for the following activities if assistance is needed. Read each question carefully and keep in mind that there are examples provided in each section to assist with answering the intent of this question. This indicator is one of the indicators utilized in calculating your agency's value-based purchasing score. Throughout the episode of care, clinicians should instruct patients and caregivers on ways to increase independence with all self-care and all medical treatments, and should show improvement at discharge. The time measure in which these indicators are collected is at start of care and resumption of care OASIS, as well as discharge from the agency OASIS. To collect this data, you may consider discussing with the patient or caregiver all aspects of care needed and provided. Ask how meals are prepared, and if they have any help, ask about grooming and any medical treatments that the patient requires. Medicare's intent for this indicator is to identify if there's a willing and able caregiver to assist the patient that is not provided by the home health care agency. The clinician should report what is known on the day of the assessment and try to identify the availability of any non-agency caregivers. At the beginning of the episode of care, day of assessment, the clinician should report if the patient has any caregivers that are able to assist with any aspect of the patient's care. Consider the patient's cognitive function or health issues that may affect the patient's ability to safely stay home, or does the patient require another person to remain in the home safely? Throughout the episode of care, the clinician can educate current caregivers or identify caregivers to assist the patient where help is needed and report the assistance at discharge. Determine the caregiver's ability in each row of selecting what is applicable. Always report the aspect of care that the patient requires the most. The greater need should be reported if more than one response applies. If caregivers are unwilling or unable to provide care, response 3 should be selected for row A through G. Determine the caregiver's ability in each of the rows, selecting what is applicable. Row A includes ADL assistance, including transfer and ambulation. Row B, IADL assistance, includes housekeeping and laundry. Row C includes medication administration and any type of medication prescribed or over-the-counter, which could include wound care and dressing changes. Row E refers to safe use and management of equipment ordered. Equipment can include oxygen, wheelchairs, and even IV infusion. Row F refers to the patient's ability to safely stay home. Row G, advocacy or facilitation, refers to the participation of the patient in the areas such as getting prescriptions refilled or following up with MD appointments.